Thank you so much. The next session will be return to play. For this, I would like to call upon Mr. Suresh, hurdles coach, to please join us. Mr. Ramakrishna Elapragada. I would like to call Mr. Ernest Paul. Please
Can
join
you have
us.
Arun? Athlete Arun, can you have Mr. Kirtan, coach, on stage, please?
We also like to have Mr. John Closter.
I think he's Dr. Anil, sir. I'll start. So, from morning we have been asking questions and giving t-shirts. So this is one question. We medical professionals don't want our athletes to ask on day one of the injury, when can I get back to play? Even before diagnosis, or once you have a diagnosis done, whether it's a conservative management or a, surgical management, they just want to know when can I get back to play. And it's a very difficult one. Various people have their own strategies to give answers how they manage it. So this is the traditional approach which was earlier in existence, where a traditional return to play was based. It was time based, knee focused, and then just the surgeon saying yes, you are good, and goes on. And now we are moving on to a biopsychological frame where you have a criteria based evidence, what it says. Then you have the sensory motor spectrum, multi-segmental. Then we are looking at interactive individual, their kind of task and work environment also, not only the sporting. Then it is a continuous process, and you have a system where it is a decision made by the operating surgeon or the person who's treating him, the coach and the player. And some of the research, what they say is, you make the collective information and leave the decision making to the athlete, that they should be knowing what it is to be done. So most injuries and pathways expected to be this, but never this. This is what, and most of the time we physios are the ones who are caught up at this, and we need to show them this when we see this. And we know the pathway. I know initial there is questions, it's paining here, I feel this, and we know that this is how they are going to go off the pain. But we need to, use our own ways how we put that confidence back, and we know the journey, what we have seen with our other patients and how they rehab. So only thing is we need to replicate that into their visionary. So this is complex. Athlete, coach, so many things coming into play, everything adding their bits and pieces. So when you have a criteria base, you need to have phases which you can divide on your own for any injury, and then everywhere you make your criterias and then you pass on. So return to activity, return to sports, return to play. This is where you need to have that first line to tell, okay, we can start your activity at that level or at that time. So I would like to pass on the question to Kirtan sir. If you understand this pyramid, return to activity, return to sport, return to play, return to competition. So you would have had this question to any of the medical profession, when they can play. Yes? So when your question was when they can play, was it this part of the pyramid or this part of the pyramid?
It's a very specific question. However, my expertise is totally based on the sport, okay, rather on science or medical side. So I will speak in related to the sport. So when, when we can start. It
Yeah,
means
so that will be your return to activity.
Yes,
Yes.
return to activity. So the same question I asked our Dr. David Rajgaru also. So then the next immediate question is, when is the competition?
Yeah,
When
so
she need
from
to
the
be-
pyramid here, we straight away jump to the
Okay.
top of the pyramid.
Yes. Then the physio, means Ganeshji has come in. This is the phase, this is the program, and the physios came in. So to be very open and frankly speaking, it's collective of a teamwork. So we need to leave it to the professionals, okay, who are well expertise in the line of their own expertise. So the answer is when we can start the activity post rehab.
Okay.
Yeah.
Sir, Rajni sir, so sometimes when you do your biomechanical analysis and the player might ask a question in the same line, so what is my fault, when will it, or how do I get it better? So how do you approach to those things?
Normally, athletes don't come with technical questions. So generic, their generic intention is, how can I peak my performance? And
When?
if he is injured, what is the shortest period of time I can get back? These are the two questions, whether it is coach or athlete. But when it comes to biomechanical analysis, I am telling you frankly, having set up South Asia's biggest lab at the cost of 18 crores, now we are collecting the data, we are able to decode the complexity of data to the knowledge of coaches and athletes, but still the gap is wider. Still we are finding it very difficult to narrow it down. So I take this Ortho-One workshop, maybe conclave, it is a sign of narrowing down where the athletes and coaches can understand so the importance of this. And coming to your point, when it comes to biomechanical analysis, it is not one perspective. It is not only one aspect where we need to sit with the coach, physiotherapist, then exercise physiologist, then we come to one solution.
So when we look at the sporting, we just discussed about the pyramid. So it's like always into, first is return to participation, then to sports, and then to performance. Now, sir, when we do our injury management, we know the healing time for each tissue and how much time it is going to take. Now let's take, you are doing a biomechanical analysis for a person's bowling or a smash. So you will suggest some corrective measures. What is the time frame you will look to do a re-evaluation to see whether it has been done?
A very good question, sir. Thank you for the question. So actually, whenever we assess any athlete in Indian context, we never tell them your action is wrong. So we just collect the data and we indirectly give them some suggestions, and the time period is every quarter, minimum 3 months time. The next minimum 3 months time we give, the next assessment will be on 90 days after. So during this 90 days period, so we will suggest them some unlearning and relearning process in case of
So
poor technique.
your reassessment timeline is 90 days?
90 days, yes.
Okay. Herman, can I have a question with you? So if you see this, we are looking at the different tissues and the timeline. If we look at strength and conditioning aspects, let's say we want an athlete to improve his strength component alone. What will be the time frame you will be looking that he will need this many days to improve his strength?
I think it differs a lot. So I think it depends on the type of injury that the player had. It depends on the type of program, but usually
Or the strength component, if you have started a program
Yeah,
When would you like to do a
a
re-evaluation?
re-evaluation.
For strength alone.
So if it's a beginner athlete, I'll give it a little bit longer time, between about 8 weeks.
8 weeks.
Because I feel it's important for them to see the improvement. Although we do regular assessment throughout, just in a sense that you can see when they get stronger, exercises become easier, so you need to progress in exercise. You can control a weight better or a movement better. So that's like small victories that you can make them aware of. That's already like little assessments. But a big assessment, for the first one, I'll go about 8 weeks, and then from there you can maybe go a little bit longer.
Okay, so from the exercise point of view, that's 8 weeks, 2 months, and the biomechanical understanding, at least minimum 3 months. So what happens if you are going to go back to sports a little too early? The problem can be if you are going to be a little delayed, being more safer, then it could be an end of career or decreased performance. And if you're going to be early, then your chances of re-injury. This is sometimes very difficult to differentiate and tell the players. The player come and tell to you at 8-month post-op, and he's fine, and he still says, I'm doing physiotherapy. And I'm like, okay, what does physiotherapy mean? It's just an exercise and you're doing your... So to differentiate, sometimes it's very difficult. People think if the physio says it is physio, if the trainer says it's a fitness training. So how to differentiate that? It can be based on how we prescribe them, you know, whether it is a functional training or those kind of things, then it can make a little bit of sense on that. And this is the injury rehab protocol, what we need to look at, where we start with any form, whether it's a knee, ankle, lower limb. We start with range of motion, then we start incorporating the proprioception neuromuscular balance, and the plyometrics has to be only in the last. And again, it can be started with low load and then progressed. And we need to have these kind of facilitators when we are doing our post-injury rehab before they go on to play. There has to be good verbal command, vision, contralateral rim they have to use, and the sensory input. Sensory input can be bare feet, visual clue, monitor, mirror, anything. All these things are going to help them regain their original movement. You know, when we start the ACL or an ankle TA rupture and all those things, when we start them to run at the 3rd month or 4th month, they feel they have forgotten how to run. The body does not do. But I encourage the patient that keep running, you'll pick up into your normal mechanism. So if we go on to the literature, the proprioception and kinesthesia, these are two words which are used quite often, and they are used sometimes in the neurology and sometimes in the orthopedic setup. Those are points which, again, earlier we have discussed how the body's information is passed on. So we want that system to go back and tell our brain that my knee is getting better, it can now take up the load. So these are various systems which is incorporated in the second stages where we want to go them. So this is how you can differentiate your 3 parts of training. All of them will look very similar. It's only how you try and incorporate what component very specifically. And the most important thing is you have to understand that whatever neuromuscular training we give, it should reach till the motor cortex level. The spinal level is like a reflex system. I just did it off today. No, it has to adapt and go and reach till the motor cortex level. Only then you know that this is in the system which works automatic. So you need to give that time to see that any time I put in, he still be able to do. So these are some of the objective assessments that's available, questionnaires, what we can do, and in the hamstrings we saw how you can do an isokinetic test. We're going to talk about the kinesiophobia. I have Anil sir, your take on post-injury, the mentality, and to overcome them, your points.
Yeah, I'm sure post-injury rehab is not only physical, it is also mental. And more often, it all depends on the trust the athlete has in the protocols. So I've seen athletes who have recovered and bounced back to performance. They have all trusted the treatment and the rehab. So when the doubt factor is set in, naturally your consciousness goes to the injury part. And this again gives a rewinding to the central nervous system. There's something wrong, and it again guards the injury prone area. So I think the trust is very important. The optimism of how you want to come back after the injury, the response to the injury and the rehabilitation protocols. I think these go a very long way in making the athlete into the sport, into competition and performance. I would say I would be thankful to Dr. David Rajan because he had done a surgery on me, ACL, in 2015. When everybody said that this is end of your career, you should stop it. I played again. I had a Achilles tendon rupture in another after 10 years. And last year I represented India in the Masters World Championship. So the trust and the comeback is a very, very psychological phenomenon.
Psychological. Yeah. First thing is psychological. Yes. Yeah. So now I have Arun. He's a 100-meter athlete who's getting his training and rehab with us. So he's had few injuries. Initially he was sent to us with a gluteal tendinopathy, doubtful thing, MRI showing, but then I did a test on hamstrings and this quadriceps ratio where I found that his force production was poor and just put him on strength training alone. And then he had a hamstring strain and now a stress. So Arun, நீங்க சொல்லுங்க உங்க இன்ஜுரின்னு வந்தது ஃபர்ஸ்ட் டைம் செகண்ட் டைம் இது. ஸோ உங்களுக்கு அந்த மென்டாலிட்டி வந்து ஒரு பிளேயராக வந்து நீங்கள் என்ன எதிர்பார்ப்பீங்க?
குட் ஈவினிங் எவ்ரி ஒன். இப்போது சார் சொன்ன மாதிரி எப்படின்னா இங்கே நிறைய அத்லெட்டு இருப்பீங்க, அவங்களுக்கு தெரியும் நம்ம இன்ஜுரி டைமில் நம்ம எவ்வளோ ஸ்ட்ரெஸ்ஸாக ஃபீல் பண்ணுவோம் அப்படின்னு. ஏன்னா நம்ம கிரவுண்டில் போய் அவ்வளோ ஹார்ட் ஒர்க் பண்ணி நமக்கு வர்ற பெயினை தாண்டி நம்மளோட மைண்ட் ஸ்ட்ரெஸ் ரொம்ப இதில் அதிகமாக இருக்கும். ஆனால் இதுக்கு முன்னாடி நான் நிறைய பிசிஷன் பார்த்துருக்கேன், எனக்கு நிறைய இன்ஜுரிஸ் வந்திருக்கு. அங்கே போயிட்டு எனக்கு எப்படின்னா they put some needle, then go back to home, take rest for 2 days. After you go training, again you feel, if you feel some pain, come here, I will put again needle, then go for training. Again you have pain, come here. பட் ஆனால் இங்கே வந்து எப்படின்னா இவங்க இங்கே வந்த வரைக்கும் நானே ஒரு இன்ஜுரியில் வந்து நானே கேட்டுட்டேன். ஒரு 1 month ஆச்சு, ஒரு ரீஹபிலிட்டேஷன் ட்ரைனிங் கொடுத்துருந்தாங்க, நான் அதை பண்ணிகிட்டே இருந்தேன். எனக்கு ஒரு ஃபஸ்ட் மந்த்து எனக்கு ஹோப் இல்லை. நான் இங்கே ஒரு 6 மாதத்துக்கு முன்னாடி தான் வந்திருந்தேன். ஃபஸ்ட்டு என்னோட எம்ஆர்ஐ வந்து டாக்டர் சந்தோஷ் சார் தான் பார்த்தாரு. பார்த்துட்டு ஒன்றுமே இல்லை, சரி நான் உங்ககிட்ட கணேஷ் அனுப்புன்னு சொல்லிட்டு கணேஷ் ஈஸ் மை ஃபிசிஷியன் இவர்கிட்ட அனுப்புனாங்க. இவரும் பார்த்துட்டு தே டியூன்டு மை மென்டாலிட்டி ஓன்லி. அவங்க எந்த ட்ரீட்டும் பண்ணல, எந்த நீடலும் பண்ணல, எதுவுமே பண்ணலாம். ஃபஸ்ட்டு ஒரு 1 month ஆஃப்டர் நான் கேட்க ஆரம்பிச்சிட்டேன், சார் என்ன நீங்கள் என்ன ட்ரீட் பண்ணுறீங்க, சும்மா தொட்டு பார்க்குறீங்க, இதை பண்ணு அதை பண்ணிட்டு போய் விட்டுடுறீங்க, நானும் போகிறேன் பண்ணுறேன், மறுபடியும் ஏதோ ஒன்று பண்ணும்போது எனக்கு பெயின் வருது, நீங்கள் சரி எனக்கு நீடில் பண்ணுங்க இல்லை கப்பிங் பண்ணுங்க, ஏதோ ஒன்று பண்ணுங்க, நானே வாய் விட்டு கேட்குறேன். ஆனால் அவங்க பண்ண மாட்டேன், நோ நான் பண்ண மாட்டேன், நீ போ, நான் இதை பண்ணு, உனக்கு இந்த இடம் வீக்காக இருக்குது, இந்த ட்ரைனிங் பண்ணு அப்படின்னு சொல்லிட்டு அனுப்பிடுறாங்க. இப்போ என்னென்னா மற்ற இடத்துல எனக்கு நீடிலிங் பண்ணி நான் போய் மறுபடியும் பெயினோட வந்து மறுபடியும் நான் அந்த ஸ்ட்ரெஸ்லேயே இருந்து ரெஸ்டிங் டைமும் ரொம்ப அதிகமாக இருந்து எனக்கு அந்த பர்ஃபார்மன்ஸே போகிற ஒரு ஃபீல் வந்துடும். இங்கே அதுக்கப்புறம் ஐ ரியலைஸ் தட் இவங்க எப்படி சொல்கிறாங்க அப்படின்ட்டு, என்ன ஸ்ட்ரென்த் அண்ட் கண்டிஷனிங் சொல்கிறாங்க, எந்த மசில் வீக்காக இருக்குது, அதுக்குண்டான ட்ரைனிங் என்னை மைண்ட் அளவில் என்னை டியூன் பண்ணிட்டாங்க, என்னை ரெடி பண்ணிட்டாங்க. ஆக்சுவலாக இங்கே வந்ததுக்கப்புறம் நான் அதாவது ரெஸ்ட்டில் இருக்கேங்கிற ஒரு ஃபீலே எனக்கு வரல. எப்படி நான் ஒர்க் அவுட்லேயே தான் இருக்கேன். யூ டோன்ட் கோ டு ட்ராக், யூ டூ சம் அக்வாட்டிக் ட்ரைனிங் அண்ட் கொஞ்சம் டைம் ஸ்பெண்ட் பண்ணுங்க இன் ஜிம் ட்ரைனிங்கில். இது மட்டும்தான் எனக்கு கொடுத்தாங்க, நான் ரெடி ஆகிட்டேன் ஆக்சுவலி.
How was your performance எப்படி இருக்கு?
இப்போது ஒவ்வொரு இன்ஜுரிக்கு அப்புறம் நான் ட்ராக்குக்கு போகிறப்போ பயப்படுறது தான். 2 மாதம் என்னை வீட்டிலே இருக்க வச்சுட்டாங்க. இந்த சும்மா ஸ்ட்ரென்த் கண்டிஷனிங் இந்த ட்ரைனிங்லேயே என்னை உட்கார வச்சுட்டாங்க. நான் ட்ராக்குக்கே போகலை. என்னோட பழைய ஸ்பீடு இருக்குமா, ஏன்னா எல்லாத்துக்கும் தெரியும் 100 மீட்டர் டேஷ் வந்து ஸ்டார்ட் டு எண்டு வரைக்கும் பிக்கப் மட்டும்தான், எங்கேயும் பிக்கப் எதுலேயுமே ஸ்லோ பண்ணுறதே கிடையாது. பிக்கப் டு பிக்கப் என் டு என் முடிஞ்சிடும். நான் என்ன யோசித்தேன், சரி நான் 2 மாதமாக பண்ணவே இல்லை, வெறும் இந்த கண்டிஷனிங் ட்ரைனிங் தான் மட்டும் தான் பண்ணிட்டு இருந்தேன், நான் எனக்கு எப்படி இருக்குன்னு தெரியும். ஆனால் முன்னே இருந்ததை விட எனக்கு இன்னொரு 10 to 20% பர்ஃபார்மன்ஸ் அதிகமாக தான் போச்சே தவிர கம்மியாகலை என்னோட பர்ஃபார்மன்ஸ். ஒவ்வொரு செட்பேக்கில் இருந்தும் நான் வெளியே வரும்போது ஐ வில் பிகம் பெட்டர்.
So this was all using the principles of specificity and overload principle consistently, but using different forms. So he always wanted to go to the track, but I said track not possible now. Aquatic, gym, without downing the load. So why we do tests for, to have an idea. So it's just an objective and quantitative, but we also saw that what John was telling, that sometimes you do a test, the data might not be relevant to what they are doing, but when we are looking at an injury and then return to play, we need to have some understanding of whether they are ticking all the boxes and is it safe to get back. So if we have a pre-injury level assessment, then we can take that, or we use the opposite one, or what we have been able to do is the kind of assessments we have done for athletes over a period of time. Now we are able to compare that values with the newer athletes when they come. So a simple assessment can be made. You can pick and make your own assessment, but you definitely need to have one. So to progress, you need to have what are the criteria are there should be no pain or instability in terms of ACL. He should have undergone an advised rehab program. He should have full range, proper gait and all those things. Only then you can go into a testing. So these are some of the tests, what components you can look. So the clinical tests, what commonly, but this is not done immediately after the surgery, but it is done on a routine for the knee. So functional tests. So these are some of the functional tests. Everybody will be knowing them. So as and when, how you want to incorporate them. So usually in Ortho-One, what we do is in the ACL patient, we incorporate them at the 6th month at a low intensity to know how much they are able to do. The same thing can be done for even a conservative managed patellofemoral or an ankle sprain. So Rajni sir, I have a question for you. We have this subject in biomechanics where we talk about joint synergies, ankle synergy, knee synergy, hip synergy. I realized the importance of them only in the last 5 years. So when we do a hop test or a single leg squat test, we can still look at those synergies, saying that, okay, these are the systems, they are compensating for them, just like how we look at the kinetic chain. Any take on that?
So it depends upon the athlete's strength profile and technique. For example, some athletes are speed dominant, some athletes are strength dominant. Say for an example, I come about with some real-time example. So long jump is an event which has approach run, takeoff, flight and landing. So the long jumpers come with maximum speed at control speed, and at the time of takeoff they have to go for application of more amount of force. And there are some athletes less in speed and better in application of force. There are some good athletes who has better speed, poor in, lesser in strength. So these two type of athletes will have different muscle energy, joints energy. So ankle over knee, knee over hip. So this synergy will vary, depends upon the individual athlete's technique as well as strength symmetry.
So then this is another test you can do for a broad jump. What we will be looking here is equal weight distribution and the triple hop test. So the primary thing is we want to see that you can jump and maintain your balance. So sometimes you'll find people jumping and hopping a bit on and off. So you can see that there's a jump and a slide thing. So, or whether they are using too much of trunk. So then we look at the trunk synergy. This is again crossover, so you're just challenging it with directional. There you go, you can see the left one where he struggles a little bit on them. These are lateral hops. So we will also see whether he can go on a little faster on them. So drop jumps. So quite a bit of the time this is where they have a lot of fear that they might not be able to control. So we start at a low level or on the ground level and then slowly progress them. And that's your single leg squat. Calf rise again is a very important one if you are going to look at rehab, because that's going to be the first mechanism to kick in where it is going to take over to the knee joint to have the quadriceps and the glutes firing on. Then the Y balance or various other tests. So we saw the isokinetic testing, which can be a gold standard to have for the return to test. So this is what our report, what we do with this is we look at the power generation, what we are able to see from the athletes, and it does give us what deficit they have. But what we have also understood is now we have a better understanding for people, just this data is not enough. We need to know if the athlete is saying that I exercised regularly, properly, then I'm looking at somewhere around 290, 300. But if the guy is not exercising or not done the exercises properly, it will still be at 140, 120, and the deficit will be less. That is not good. That means he's not reached up to the level of the force production what we want him to come out with. So we want that ratio between the quadriceps and the hamstring to be less than 0.75. And the balance and neuromuscular control is again very important. We start simple with a firm surface, then with markers to see how you have a visual feedback, sensory input, then with an unstable surface and trying to be balanced. The core and general fitness will all be added up. So this will be the general activity beginning. Whenever your injury is there, when you can start your basic activity. Return to competition is the last of the pyramid. So these are some of the scoring systems that can be done. So what can be seen is that there is no universal criteria as such, but you'll have to know the injury, what tissue is involved, what is the healing time, and what is the demand. Whether jumping is a demand or running is a demand, based on that you can make your tests. But mandatory so that you know that how you are preparing your body. And then when to do. In a ACL scenario, we are looking at 8 to 12 months, but you can take it for each and every injury and then plan your timeline when you want to introduce a test to start your activity. And then what you need to have is your full range. Mr. Paul, I have a question. We have quite a bit of physios and athletes sometimes who volunteer, like Arun told, needling, cupping and send. Does taping and braces help in athletes to go through the process of the injury rehab and to some extent to perform?
Sir, the braces and tapes do have a role, but there are positives and negatives also. So the braces, it gives them stability, sometimes pain relief. But and also they'll get a sense of security when they wear the brace. But the negative aspect is when they get used to the brace, there'll be over reliance on the brace. And once they rely more on the brace, the muscle which has to act, that will get shut down. So the desired muscle which has to work won't work. So when we ask them to play without the brace, then it will be difficult for them to perform, and that affects their performance. And regarding the tapes, there are different types of tapes. So like kinesiology tape, rigid tape, dynamic tape, and meconal tape and sports tape. So in the rehab process, what we can use is definitely we can use kinesiology tape to facilitate muscle function. The on-field injuries, on-field management and all, we can use a rigid tape. And again, there is another important, we use a tape to wean off the brace. So if somebody is using a brace, suddenly we cannot just remove the brace and we can not ask them to play. So to wean off the brace, we remove the brace, then apply tape for a few days. We ask them to play when they are comfortable, then we just stop that also. And regarding tapes on field, I would suggest there is a good tape. It's not a sports tape or a kinesology tape. I just use a Dynaplast. So that offers more stability and support to the joint. So that's my take on it. Thank you.
So you also have to know that tapes are banned in few sports where they consider that they can enhance the performance. In swimming it is banned, in basketball it is banned, in shooting it is banned. So that is still there, that they say that they can enhance by the proprioceptive mechanism. So they don't allow you to perform with the tapes on.
I'll add one more point. So I was working with the Indian swimming team. So what they do is, the taping is not actually banned. They don't apply tape on the body. Before the competition, they actually shave their hair also. Because even if they have the body hair, that will increase the water drag. So that is counterproductive. If we stick a tape, so their performance will come down. So they don't use tapes in swimming sport.
It's a rule also that
Yeah.
you cannot have anything on the skin.
Okay.
So the last one is. So
Really well, but impacted the match so much.
So
but
we know
also
about
had a
Rishabh
special
Pant's
person to give the
injury.
gift.
I think this is after the
I don't need to say
India-Pakistan
much,
match.
sir. All yours. Thank you so much.
Of course I'll say. But first of all, winner of this medal is Rishabh Pant. And where the hell is First, give me a hug. Well, all I'll say for Rishabh, first of all, brilliant performance today. Great character shown by the boys. But I had tears in my eyes when I read about his accident. And when I saw him in hospital, it was even worse. And then for him to come back from there and be back in the A zone playing one of the biggest games of all time, India versus Pakistan, is heartwarming. Batting, everybody knew what you're capable of, the X factor you have. But your wicket keeping and the range of movement that you've got so quickly back in after the operation is a tribute for how much you worked hard. And not just for yourself, it's an inspiration to millions around the globe that from adversity, from the jaws of death, you can snatch a win as well. So well done, fantastic, and keep up the good work. And keep going. And enjoy it, guys. Well played today.
So the Indian team has a tradition now
Really well,
after
but
every match.
impacted the match so much. But we also have a special person to give the gift.
So they have a tradition where they select the best fielder of that particular match. So this was Rishabh Pant. Sir, your take, sir. Anil, sir. So he was the one who suggested that he wants to have this.
Yeah, I think it was a great comeback, though it was not a sports injury, but it was a great injury which almost we thought he sidelined for his career. So from there to come back and make a performance like this, it requires a great mindset, in fact. And the agility and the dynamism with which he was fielding. Batting, of course, it was okay. It was acceptable. But I think it is a great comeback. It's a great inspiration for many people that life is not end with an injury. You follow a protocol, trust the experts, and keep a positive mindset, optimistic. You can always do wonders in sports. Right.
Herman, I have a question. How do you pick your clients have fear in the movement? They don't come and tell you that I am scared of doing this. But they might use some other ways to, give you a hint, or you might be able to pick. So can you share something how you pick them?
Yeah, definitely. I think the positive thing about working with an athlete for so long or for a prolonged time or period makes it easy to really get to know that athlete. And once you know them, you know their body language, you know their facial expressions, you know how they react to certain things, and when when they put in a position where they feel uncomfortable, or where you just pick it up. For some reason, you can read their body language, you can read how they react to something that they would normally not. So I think for me, it helps by really get to know them. And I think that's, as part of a SNC's job, is to look after the athletes. And not only like in a physical way.
Physical, but
Yeah. So if you can like build a relationship with them, you don't necessarily have to be their friend, but build a relationship and make them feel comfortable and make them feel safe and make them feel like that you care. And then they'll open up, and then I think in a way like this, then you'll pick it up easily. Yeah, body language, facial expressions, and then you'll sense that they feel unsafe or
Yes, thank you very much. So to just conclude, rehab should be wholesome, test all the components involved. So when we say components, it's not all the tests, components, whether you're looking at strength, flexibility, neuromuscular control, jumps, whatever is required. Those components try and use with tests. Our population needs safe progression than a fast progression. So like how the athlete said, I want something to quickly fix. So that is not possible. You have to understand the physiology, pathophysiology. Based on that is how you will be able to go back to return, no shortcuts. Time-based or target-based. So you need to know the time frame and what target. So if 2 months you need to improve your strength, that's 2 months. If your technique is going to change in 3 months, then 3 months. So that's our guidelines, what we have. So we have to put it forward, be firm on that, and tell no, we cannot go back on that. Evaluation cannot predict re-injury, but will help design an appropriate fitness training and a rehab program. Yes, we cannot predict every injury, but at least we can know that if there are few parameters which can help them to know that these are the areas they need to work. So to be safe, athlete must be intelligent enough to understand their knee and follow their preventive measures more than what we need to be giving them. So if they can get that education, they are more informed and they are more aware of what their body, and they will know when to push and when to control their movements. So thank you very much, sir. Thank you.
Thank you, sir. Thank you. By this, we have come to the conclusion of all the sessions. So yes, here we have come to the end of the athletic knee prehab of the joint. Now I would like to call upon Dr. Shyam Sundar to give the vote of thanks.
Very good evening to one and all. We have had an extensive session, very informative and tiring as well on a Sunday. But still, the information is more than the wealth. I thank the Ortho-One team, the respected faculties, Herman and his partner, and SSI, Sarthak, and my colleague, and everyone have been so good and informative and patiently waiting and listening till the end. That's a great thing to see. I hope we have not spoiled your Sunday. In addition, I would like to thank the AV team, host Vinci, and most importantly the Ortho-One support staffs and the athletes who have made this event a great success. Thanks a lot. We'll meet for the next year in upper limb. Thank you.
Thank you, sir. Now I request everybody to kindly arise for the national anthem.
Thank you.
Thank you. Thank you. Once again, this is Vinci Michael signing off. Have a great evening. Go home safe. Thank you.